1. Tracheostomy. A tracheostomy, also spelled tracheotomy, is a surgical procedure in which an incision is made in the front of the neck and into the trachea, windpipe, to create a stoma, opening, through which a tracheostomy tube is inserted. This procedure is performed to establish an alternative airway when a patient is unable to breathe effectively through the normal upper airway or requires long-term mechanical ventilation. Here are the key aspects of a tracheostomy. Indications for tracheostomy. A tracheostomy may be indicated for various medical conditions and situations, including 1. Airway obstruction. When there is a blockage or severe narrowing of the upper airway, a tracheostomy can provide a clear and stable airway. 2. Ventilation support. Patients who require prolonged mechanical ventilation due to conditions like respiratory failure, neuromuscular disorders, or severe lung disease may have a tracheostomy to facilitate long-term ventilatory support. 3. Airway protection. Tracheostomies are used to protect the airway in individuals at risk of aspiration due to impaired swallowing, such as those with neurological disorders or head and neck injuries. 4. Secretion management. For patients who have difficulty clearing respiratory secretions, a tracheostomy tube allows for the removal of mucus and secretions from the trachea. 5. Facilitation of weaning. Tracheostomy tubes may be used to transition patients from mechanical ventilation to spontaneous breathing, making it easier to wean them from the ventilator. Procedure. The tracheostomy procedure involves the following steps. 1. Anesthesia. The patient is usually under general anesthesia or sedation to ensure they are comfortable and pain-free during the procedure. 2. Incision. A horizontal incision is made in the neck, typically just below the level of the cricoid cartilage. The trachea is exposed through this incision. 3. Creation of stoma. A small opening, or stoma, is made in the trachea, and a tracheostomy tube is inserted through this hole. 4. Tube insertion. The tracheostomy tube is secured in place with sutures or a specialized device. It has an outer cannula and an inner cannula that can be removed for cleaning and maintenance. Types of tracheostomy tubes. There are different types of tracheostomy tubes, including 1. Cuff tubes. These tubes have an inflatable cuff that creates a seal in the trachea, preventing air from escaping around the tube. Cuff tubes are often used during mechanical ventilation to protect the airway and facilitate positive pressure ventilation. 2. Uncuffed tubes. These tubes do not have a cuff and are used when a cuff is not needed or when the patient has difficulty tolerating a cuff. Care and management. Patients with tracheostomies require specialized care and monitoring, including regular cleaning and maintenance of the tracheostomy tube, managing secretions, and preventing infection. Suctioning and humidification may also be necessary. Decannulation. If the underlying condition improves, patients may undergo a process called decannulation, in which the tracheostomy tube is removed and the stoma heals. This is done once the patient can breathe and manage their airway effectively without the tube. Tracheostomy care. Nursing care for a patient with a tracheostomy is crucial to ensure the patient's safety, comfort, and overall well-being. Patients with tracheostomies require specialized care to maintain the tracheostomy tube, manage secretions, prevent infection, and support the patient's respiratory needs. Here are key aspects of nursing care for a tracheostomy. 1. Monitoring. Regular and continuous monitoring of the patient's respiratory status is essential. This includes observing respiratory rate, chest movement, and the color of the tracheostomy tube cuff, if present. Changes in respiratory rate, chest rise and fall, or the color of the cuff can indicate potential issues. 2. Suctioning. Tracheostomy patients often have increased mucus production. Nurses must be skilled in sterile suctioning techniques to clear secretions from the tracheostomy tube. Frequent suctioning may be needed, but it should be done with care to avoid complications such as infection or tracheal damage. 3. Humidification. Providing humidified air or oxygen can help prevent the drying of secretions and maintain airway moisture. Humidification can be delivered via a heated humidifier or a heat and moisture exchanger, HME, attached to the tracheostomy tube. 4. Tracheostomy tube care. Routine care of the tracheostomy tube includes cleaning, changing the inner cannula, if applicable, and checking for secure placement. It's important to use an aseptic technique during these procedures to minimize the risk of infection. 5. Skin care. Proper skin care around the tracheostomy site is essential to prevent pressure sores and skin breakdown. Regularly inspect the skin for signs of irritation, redness, or breakdown. 6. Dressing changes. If the tracheostomy site is covered with a dressing, it should be changed regularly and kept clean and dry. Ensure that the dressing does not obstruct the tracheostomy tube. 7. Emergency preparedness. Nurses should be trained in recognizing and responding to emergencies related to the tracheostomy, such as tube dislodgement, obstruction, or respiratory distress. Having emergency equipment and a tracheostomy kit readily available is essential. 8. Preventing infection. Strict infection control practices, such as hand hygiene and proper equipment sterilization, are crucial to prevent tracheostomy-related infections. 2. Chest tubes. Chest tubes, also known as thoracostomy tubes or chest drainage tubes, are medical devices inserted into the pleural space, the space between the chest wall and the lung, to remove air, fluid, or blood and help re-expand a collapsed or partially collapsed lung. They are used in various medical situations to treat conditions that can result in abnormal accumulation of air or fluids in the pleural cavity. Here are the key aspects of chest tubes. Indications for chest tubes. Chest tubes are typically inserted for the following medical conditions and situations. 1. Pneumothorax. Chest tubes are used to treat pneumothorax, a condition in which air accumulates in the pleural space, causing the lung to collapse partially or completely. 2. Hemothorax. When there is a collection of blood in the pleural space due to injury or bleeding, a chest tube may be inserted to drain the blood. 3. Pleural effusion. Chest tubes are used to remove excess pleural fluid, which can accumulate due to various medical conditions, including infections, cancer, and heart failure. 4. Postoperative care. After certain chest or lung surgeries, a chest tube may be placed to drain air or fluid that can accumulate in the pleural space. 5. Placement and care. The placement of a chest tube is typically performed by a healthcare provider, such as a surgeon or interventional radiologist. The procedure involves the following steps. 1. Anesthesia. The patient is often given local anesthesia to numb the area where the tube will be inserted. In some cases, general anesthesia may be used. 2. Incision. A small incision is made in the chest wall, typically in the area where the tube is needed. The healthcare provider carefully inserts the tube into the pleural space. 3. Securing the tube. The chest tube is sutured or secured in place to prevent movement. It is then connected to a drainage system. 4. Drainage system. The chest tube is connected to a drainage system, which can be a collection chamber, water seal, and suction control system. The drainage system allows for the controlled removal of air, fluid, or blood from the pleural space. 5. Monitoring and management. Nurses and healthcare providers monitor the chest tube to ensure it is functioning properly. This includes observing the drainage system for proper suction and monitoring the volume, color, and character of the drained material. Complications, such as air leaks or blockages, should be promptly addressed. 6. Removal. Once the underlying condition is resolved, and there is no longer a need for the chest tube, it can be removed. This is typically done by a healthcare provider and requires careful observation to ensure that the lung remains stable. 7. Patient education. Patients with chest tubes require education on how to care for the tube and recognize signs of complications, such as infection, dislodgement, or increased drainage. Chest tube drainage system. The drainage system for chest tubes used for suctioning consists of several chambers that serve specific functions in monitoring and controlling the removal of air, fluid, or blood from the pleural space. These chambers are designed to facilitate the continuous assessment of the patient's condition and the effectiveness of the chest tube. The typical components of a chest tube drainage system include: 1. Collection chamber. This chamber is the first point of entry for fluids and air removed from the pleural space. It allows healthcare providers to monitor the volume and character of the drainage. The collection chamber typically has graduated markings to measure the output. 2. Water seal chamber. The water seal chamber is designed to prevent air from re-entering the pleural space while allowing excess air to escape. It contains sterile water, which acts as a one-way valve. The water-sealed chamber has a column of water with a specific depth, and as air exits the pleural space, it bubbles through the water but does not flow back into the pleural space. This chamber helps maintain negative pressure in the pleural space. 3. Suction control chamber. The suction control chamber allows for the regulation of the amount of negative pressure, suction, applied to the pleural space. It is typically connected to a wall suction or a portable suction device. The chamber contains a column of water or fluid that is adjusted to the desired suction level using a dial or regulator. The healthcare provider sets the prescribed amount of suction based on the patient's clinical condition and the type of therapy needed. 4. Air leak monitor, if applicable. Some chest tube systems include an air leak monitor, which is a chamber that detects and displays air leaks. It typically has a column of water and a floating indicator. Air leaks are indicated by bubbling in the chamber. Healthcare providers use this to monitor and assess the presence and severity of air leaks, which can be important in managing conditions like pneumothorax. Nursing considerations. Nursing considerations for the management of a chest tube drainage system used for suctioning are critical to ensure the patient's safety and well-being. These considerations involve ongoing monitoring, assessment, and interventions as needed. Here are key nursing considerations for the management of a chest tube drainage system with suction. 1. Initial assessment. Perform a comprehensive assessment of the patient before chest tube insertion, including respiratory status, vital signs, and chest examination. Verify the correct placement of the chest tube by assessing for breath sounds, chest X-rays, and monitoring chest tube placement in the drainage system. 2. Infection control. Maintain strict aseptic technique during chest tube insertion and dressing changes to prevent infection. Assess the insertion site for signs of infection, such as redness, warmth, swelling, or drainage. 3. Monitoring drainage. Continuously monitor the volume, character, color and consistency, and odor of the drainage in the collection chamber. Document output and report any sudden increases in drainage, which may indicate bleeding or increased fluid production. 4. Water seal chamber. Monitor the water seal chamber to ensure it remains at the prescribed level. Assess for continuous bubbling in the water seal chamber, which may indicate an air leak. Intermittent bubbling with patient breathing is normal. 5. Suction control chamber. Maintain the prescribed amount of suction in the suction control chamber as ordered by the healthcare provider. Check for any kinks or obstructions in the tubing leading to the suction source. 6. Air leak assessment. Continuously monitor for air leaks by assessing the air leak monitor, if provided, and inspecting for bubbling. Report any changes in the pattern of bubbling. Ensure the system is airtight and that connections are secure to minimize the risk of air leaks. 7. Securing and dressing. Keep the chest tube securely anchored and well dressed to prevent dislodgement or tension on the tube. Monitor the dressing for signs of loosening, wetness, or contamination. What to do if the chest tube comes out? If a chest tube becomes accidentally dislodged or comes out, it is essential to take immediate and appropriate action to minimize the risk of complications and ensure the patient's safety. Here are the steps to follow if a chest tube is accidentally removed. 1. Assess the situation. Quickly assess the patient's condition, including their respiratory status, vital signs, and overall well-being. Look for signs of respiratory distress, such as increased respiratory rate, chest retractions, and decreased oxygen saturation. 2. Provide oxygen. If the patient is in respiratory distress or has decreased oxygen saturation, provide supplemental oxygen using a mask or nasal cannula to maintain oxygenation. 3. Call for help. Alert the healthcare team and call for immediate assistance. Inform the physician or surgeon who placed the chest tube about the situation. 4. Cover the site. Use a sterile occlusive dressing or petroleum gauze to cover the stoma, the opening where the chest tube was inserted, to prevent air from being drawn into the pleural space. Apply the dressing securely to create an airtight seal. 5. Stabilize the tube. If the chest tube is still partially in place and not completely removed, gently secure it to prevent further dislodgement or movement. Use sterile dressings, gauze, or an abdominal binder to secure the tube. 6. Observe for air leak. Continuously monitor the patient for signs of an air leak or pneumothorax. Watch for subcutaneous emphysema, a rising water level in the water-sealed chamber, or changes in the patient's respiratory status. 7. Prepare for reinsertion. The patient will likely require a new chest tube or reinsertion of the dislodged tube. Prepare the necessary equipment and supplies for the reinsertion procedure. 8. Maintain infection control. Ensure aseptic technique is maintained during the reinsertion procedure to prevent infection. 9. Documentation. Document the incident, actions taken, the patient's condition, and any communication with the healthcare team. 10. Educate the patient. Explain the situation to the patient and their family, keeping them informed and reassured. Discuss the need for a new chest tube or reinsertion. 11. Prevent future dislodgement. Address the cause of the dislodgement. Ensure that the chest tube is properly secured and dressings are intact to minimize the risk of further dislodgement.